Hi, I'm so delighted to meet you in the program of 1 minute please. What is hyperkalemia? Hyperkalemia is defined as potassium level greater than 5.5 milliequivalent. What are the important causes of hyperkalemia? So the most important cause or one of the important causes of hyperkalemia is pseudo hyperkalemia or spurious hyperkalemia, where your total body potassium remains normal, and in fact your serum potassium level would be normal, but the problem is hemolysis from the specimen. When patient makes excessive fist pumping while blood is withdrawn, or when tourniquet is applied, or when syringe is used in the place of vacuum divisor. So what happens all these procedure? Hemolysis of specimen. When hemolysis of specimen occurs, what happens? The potassium is released from the RBC, resulting in spurious or otherwise called pseudo hyperkalemia. You are all aware that 98% of our potassium is well packed within the cells rather than in the plasma. Apart from that, there are few more causes of hyperkalemia. One of the important causes of hyperkalemia is acute kidney injury or chronic kidney disease. Whenever somebody presents with hyperkalemia, never ever forget to evaluate kidney disease. So in most of the time in the kidney disease, it is the distal tubule and collecting duct are responsible for potassium excretion. When these tubules are damaged due to acute kidney injury or CKD, what happens? Your potassium accumulation occurs. Then apart from that, nutritional intake of potassium from the food, when it goes in excessive amount, that can produce hyperkalemia. But practically speaking, whenever your kidney functions remain intact, whenever your kidney function is not impaired, kidney is capable of excreting all kind of excess potassium derived from the diet intake. So increased intake of potassium from the diet alone won't make hyperkalemia in the presence of normal renal function. Then apart from that, you have one more cause would be the transcellular shift. There are three important causes that result in the transfer of potassium from the cells into the plasma. One important cause would be insulin deficiency, especially during the time of diabetic ketoacidosis. Most of us might have witnessed hyperkalemia during the presentation of DKA because of insulin deficiency. What happened during the course of insulin infusion, this hyperkalemia slowly will disappear because the insulin administration will drive the potassium from the plasma into the cells. That is the reason one of the treatment or strategies for management of hyperkalemia is insulin with 25% dextrose administration, because insulin can push the potassium from the plasma into the cells. Then apart from that, metabolic acidosis due to any cause can produce hyperkalemia, something like insulin deficiency. What happens? Metabolic acidosis shift potassium from within the cells into the plasma. Then apart from that, beta blocker can produce hyperkalemia. That is the reason when you have hyperkalemia, we are giving beta agonist in the form of nebulization to drive the potassium from the plasma into the cells. These important three causes responsible for transcellular shift. Apart from that, sometimes administration of succinylcholine can produce transient hyperkalemia by means of transcellular shift. Then even it is implicated in hyperkalemic periodic paralysis, where the problem with the sodium channel in the muscle resulting in hyperkalemia. So these are the few causes of hyperkalemia secondary to transcellular shift. So whenever somebody presents with the hyperkalemia, these are the causes to be remembered in your mind. Then apart from that, when you have hyperkalemia, but when you lack clinical symptoms, or if it doesn't correlate with ECG findings, then you have to think of pseudo hyperkalemia even in the presence of leukocytosis, thrombocytosis, because leukocytosis, thrombocytosis can produce pseudo hyperkalemia. So any patient who presents with hyperkalemia, especially if he is asymptomatic, think of spurious or pseudo hyperkalemia, but never ever forget to rule out kidney disease. And in the ICU setting, don't forget diabetic ketoacidosis and metabolic acidosis secondary to any cause. So these are the few causes I would like to enumerate for hyperkalemia. Thank you.